Okay, our subject patient that I'm going to show her ultrasound imaging next did have treatment at Kaiser Permanente after having had ultrasound, and the treatment was surgery on her vein and was done under general anesthesia. They just did simple ligation of the bulging vein in the lateral side of left calf, which did not help her at all. And her pain and remaining bulging veins, they are continued to persist. And that's when she came to me, and this is what we found. Okay, I like to talk about a varicose vein that's rather common, maybe as common as short saphenous vein reflux, but is not detected usually because technicians and doctors are not used to looking at this particular spot. At our clinic, we pay specific attention to this and some of the other anatomical variants which are not addressed in any textbook, and the ultrasound, that's why it has to be very, very much in detail and not to look at standard great saphenous and short saphenous. Our patient here has a pain on the side, and you can see varicose vein on the side, and when I do ultrasound, the short saphenous is normal, but then there is a perforator in the very lower posterolateral left thigh or lateral to the knee. There is a perforator that is causing reflux here, which is not in any textbook, and I call it for the last 10 years in conferences and everywhere. I have tried to bring attention to this vein, and I hope people are starting to look for this vein. Let's look at the ultrasound now. And look at that. So that's the short saphenous, which you can see bring no color now. Okay, this is the short saphenous. It's very, very small, and it is competent. It's not a problem. As we go to the side a little and up, then you find the varicose vein here, lateral upper calf. And if we trace it higher, then you see it turns into, it's receiving its reflux. Let me get a little more gel there. From this perforator vein, which we go in color, and you can see now I do augment release, and you can see it has a very severe reflux, this vein. So I hope that we all look for this vein at the posterolateral lower thigh or posterolateral knee. And when we see the short saphenous vein, our test is not completed. We should always look at it, especially patients who have posterolateral left calf varicose vein or even pain without visible varicose veins. And the best treatment for it is the foam washout technique, which I have explained elsewhere, and it could be seen on YouTube under foam washout.